Medicare Advantage in the great state of California. That's what we're going to talk about here today. It's actually pretty important and, frankly, it's pretty interesting. I think you'll get a lot out of this video. My aunt was in town. She lives in Los Angeles County, California, not in the city, but I guess the city is like a block away, LA County. And she just retired from a career-long medical insurance billing, right? So she has a pretty distinct career in medical, the terminology of vernacular and whatnot. And so she just retired, turned 65, and went on Medicare. Even she had to study for a long time. Said she took a year researching to figure out what she felt was the best Medicare Advantage plan or Medicare supplemental plan that she could. And it's very interesting. She showed me this one right here. It's the Blue Shield 65 Plus HMO. Oh no, HMO. But she likes it. She's a big fan of it. I'm going to dive into some of the benefits of this plan. I'm not saying it's a plan for you. I'm not saying that. But I am going to say that even though I always default to getting Medicare supplemental policies, which would be Medigap, there are some benefits of Medicare Advantage without question. One of the benefits is cost. All right, so let me share with you how this works actually. So with Medicare, so you got Medicare, you got Part A, Part B, and then Part D. So this is how Medicare works: Part A, Part B, and Part D. Part A is free. That's your hospitalization. That's your hospital. That's the building. All right. Part A is free because you were paying that as part of your FICA taxes while you're working, and your employer was as well. But Part B is not free. Part B has a premium of $135 a month as of right now. And Part B is your doctor's physician services. All right. So you get A, the building, B, the people, and then D is going to be a prescription drug. That came in 2005, I believe, under Bush. That's your prescription drug plans. All right, so that's how Medicare works. You got Part A, Part B, Part D. But notice, and this is what the Medicare for All people always overlook, is that there is still a 20% gap that you have to pay out-of-pocket expenses. So, I mean, you are not free and clear of anything catastrophic of expenditures when it comes to Medicare. So these whole things, Medicare for All, it's silly because there's still a significant amount of money that you've got to pay for. And look, that's the way it should be. I mean, there's just not this unlimited tree of money that the government has. So what they came up with two things: Part C or Med Sups. All right, so you got Part C, which is your Medicare Advantage or your Medicare supplemental policies or Medigap. And both of those will give you out-of-pocket expenditure minimum, so or maximum. You know you have a maximum out-of-pocket expenditure of if you have either Medicare Advantage, Part C, or if you have Medicare supplements, which is nice. Now, each plan is different, and there's just tons of plans. So in this case, because she has Medicare Advantage prescription drug plan, all right, so you see it says prescription drugs. What happens is we have A plus B plus D equals C. I hope that makes sense. You got hospitalization in Part A, the physician services in Part B, the drug prescriptions in Part D, and that equals C. So instead of paying for Medicare, original Medicare, which is A and B, she has Medicare Advantage Part C. Now, the drawback about any Medicare Advantage plans, an MA plan, unlike a Medicare supplemental policy or a Medigap, is that these are network plans. All right. Now, she lives in Los Angeles County, partial, and Orange County. So she does live in the partial part of Los Angeles County where she's covered under this plan in network. And I'm going to show you why that's really not a big deal in this capacity, because this is a very populous part of the world, actually, Los Angeles County. So there's tons of providers in her network local to her. In fact, it's interesting. She was just telling me today when I was taking her to the airport. She's got mammogram lined up, a colonoscopy lined up, and something else. And they just did some work, was an MRI or something like that not an MRI, something on your ankle and I think your neck to see if the blood is flowing. It was an MRI, I forgot what it's called. But anyway, it's interesting. She's had some work done for sure in terms of medical appointments, and I had no problem getting appointments, no problem seeing the doc and all that. So that's the drawback about Medicare Advantage plans, is that it is a network, right? And if you're in the network and the network isn't very big, you could be without. In fact, Alaska, what J.O. and I were talking about last year, there is no Medicare Advantage because the network is so small relative to what the insurance companies could put together. It just wasn't profitable for them. So either you're going to have original Medicare, A and B, and be on the hook for 20%, or you're going to get a Medigap policy. And that's how it works. So in here with California, because it's such a populated state, there's tons and tons and tons of plans and tons and tons and tons of providers, which I'll share with you. All right, so remember, if you're getting a Medicare Advantage, you want to make sure, at least you want to either understand if it has a prescription drug plan or not. You don't have to get it. You can always get a Part D, but you still need to find out if your plan covers that. So let's go into this. I think it's pretty cool. Oh, by the way, so she's paying for this. For A, B, and D, she's paying, I think she said $145 a month, which is significantly less than she would have paid for Part B, Part D, and then a Medigap policy. I mean, between those three, it's probably about $300 a month. So for her Medicare Advantage plan, she's paying about half. Now, does that mean she would find coverage easily if she needed a provider here in Atlanta? I don't know. That's why I got to do some research, and I'll show you how to do that. But in her area of neck of the woods, Whittier, California, there's tons of providers in Los Angeles County. So she's saving a significant amount of money, and she's also told me about the CARE program for expenses and for electricity and utility bills discounts in California, whatnot as well. Once you hit a certain age and or income threshold, you have some significant discounts awaiting. So make sure you take advantage of them. All right, so here we go. So I want to show you to join the Blue Shield 65 Plus, you must be entitled to Medicare Part A. So once you hit 65 and you've been paying it, you will be entitled to Medicare Part A. Be enrolled in Part B and live in our service area. And their service areas includes all of Orange County and parts of Los Angeles County, these zip code exception. So this is what you got to be looking for. Blue Shield includes Part D coverage, all right? So you want to make sure that it says it explicitly, and this could not be any more explicit right there. Prescription drug plan. It just can't be more explicit. If it doesn't say that, you might want to find the provider, say, hey, does this include prescription drugs? And it says right here, which provides prescription drug coverage, offering you the convenience of having both your medical and prescription drugs covered through one plan. I completely agree. Now here they got Blue Shield. Oh, look, they give us the link here. All right, I didn't want that. I got already. Yeah, we'll go back because I want to keep the PDF up there. All right, so let's go back to the PDF and I'll show you how you can find your doc. There we go. All right, so we're going to find docs. So here they say you can find a doctor, and I think it's find a hospital as well, a pharmacy or a doctor. So we're going to click on this right here, and we're going to find a doctor. All right, so we're going to say, are you Blue Shield member? We'll say no, we're not. We'll just say Los Angeles, Los Angeles, California. We're going to say continue, and we're going to say we have a plan in mind, which is this one right here, and select plan type. It's going to be a Medicare Advantage plan, Blue Shield, California, PPO, Medicare Advantage right there. Medicare Advantage, Blue Shield Plus, HMO. All right, so right there. All right, cool. So let's see what docs are available in this plan. All right, so select specialty. We'll just say, general practice first. We'll try that first, and we'll see what they got that comes up here. So any doc in here, and there's 110 within 5 miles of LA. So any doc in this plan that we just click accepts this plan. And so let's go to Felix Aguilar. Let's see what's going on with this guy. I mean, I have no idea where this guy is or whatever. He speaks Spanish and English, 22 years experience, University of California, Irvine. There's his NPI. I don't even know what that stands for. And he's accepting new patients. All right, so there you go. There's one. Let's go back to search. And there's, let's see, we got Tadao Fujiwara. He speaks Cantonese, Chinese, English, Japanese, Mandarin, and Spanish. That's crazy. Wow. He's accepting patients at accepting new patients at some locations. He is in network. All right. So you want to make sure it's in network. Autonomous University of Guadalajara. So he, I wonder if he's Spanish or Mexican by nature, because he speaks the language and he went to University in Guadalajara, but that's not a Spanish name, is it? That's a, I don't know, was that Japanese? Interesting. So, but he accepts it, and he's accepting patients, and he's in network. So let's keep going back to search results. All these people should be, we'll go to Miramodi, in network. There you go. So she speaks, she speaks Hindi and Spanish and English. So, I mean, just and they're in network. They're accepting new patients. So tons and tons of in-network people for sure. That's fantastic. Let's just go. We'll get rid of general. Let's go to like cardiologist or something like that. Let's see here. Cardiology. Let's see what we got. Cardiology. We'll hit search and see how many docs are in here for cardiology. 144. Oh, wait. It still has me. Let's get cardiology. Yeah, 144. All right. So, I mean, there you go. We got there's tons of docs in network. And so my aunt is paying $145 and has access to all these people. I guess the question I have, and I tried to do some research before, and they got this little nice convenient map. What happens if you want somebody outside of network? You're gonna have to, or outside of the local area. You're gonna have to, you have to. Let's click on here. Change your filter from California. Let's say Atlanta, Georgia. I don't know how this will work. Let's see. We're gonna hit apply. And to search outside providers outside California. So that's a way you can click here for outside providers. I'm not going to do that, but you want to make sure you do that probably before you travel. So my aunt travels to see Orlando's where I got cousins, Virginia, New Jersey, and then here. So if she were traveling and felt there could be a medical issue, she probably wants to just in advance see who's in network there. All right. So look at this, no pay. You pay no payment for this plan. You must continue to pay your Part B, which you're doing because you're putting both Part A, Part B, and Part D into one plan. But this plan of itself doesn't cost anything. And remember, Jay was saying there's lots of bells and whistles that these carriers are offering to get you to buy. It's an economies of scale. So Blue Shield says, man, if we can get more and more people on the plan, we'll have more economies of scale, which means we have more profits per person. So they're going to give you some incentive to join the plan. I'll share with you a couple here in just a second. The deductible zero. You got no deductible. Maximum out of pocket $999. Does not include prescription drugs. This is the most you'll pay for the year for both Part A and Part B. And again, Part A is the hospital. Part B is physician services. Maximum out of pocket. Every Medicare Advantage plan has a maximum out of pocket. And the reason for that, if they want to offer they're under the CMS, Centers for Medicaid and Medicare Services, they have to have an out-of-pocket maximum for the patients or the beneficiaries, which they do. Zero copay per admission for inpatient. Outpatient, you can see 85 copay for each. You can just see all this. Outpatient surgery, zero copay for each visit. Doctor visits, zero copay. Preventive care, zero copay. Urgently needed service, $5 copay. You can see all this. It's fantastic. Diagnostic radiology, $40 copay for each diagnostic radiology. I mean, it's nothing. Lab services, zero copay. Diagnostic test, zero. Outpatient, zero. Therapeutic services, you pay 20% of the Medicare allowed amount. While you pay 20% of for your therapeutic radiology service, you'll never pay more than $999 maximum allowed. It's just nuts. Hearing services, $499 copay for hearing aids, or $799 for a certain hearing aid. I'm telling you, I looked at hearing aids; they were a whole lot more than $499. Cleaning, if you got, she doesn't have dental services and she doesn't have vision services here. Actually, it's pretty interesting because she was brought up by a single mom raising 4 children, so they had no money in California. So they used to go to UCLA dentist. The dental school, because there's a dental school at UCLA who apparently gladly accepted patients to come in so the students could work on them. And my aunt does the same thing now. I think she said Yorba Linda or something like that. There's a dental school in Yorba Linda, something like that. But she goes there for her dental services because it's free. Now, I don't know if it's income restriction. I have no idea. But she spoke very highly of it. And she doesn't have vision services either. So let's keep going down. All right, look at it. Skilled nursing facility, zero copay through days 1 through 20, because that's Medicare's kicking in. Medicare does kick in for days 21 through 100. After that, though, 100-day per benefit period, no prior hospitalization required within the network. A benefit, you can realize, but after 100 days, this is where long-term care kicks in. Medicare doesn't cover you after 100 days. You are on your own, so you better have some resources if you need skilled nursing facility, i.e. a nursing home, more than 100 days. That's where long-term care covers, or in this case, probably Medicaid, because my aunt's, her only source of income is Social Security. Now, she lives in California, owns a home, has a small mortgage, but her only source of income is Social Security. She's getting by. She's not living large, but she's getting by. Because as you get older, you do get discounts. Like I said, she gets 30% discount on her electric bill, all kinds of other stuff. You can see all this. So I want to show you a couple things here. All right, medical equipment supplies. Just so you can see all this. But I want it right here. Health and wellness programs. Basic gym access through Silver Sneakers. Free through Silver Sneakers. You don't pay anything. So I think she was saying it's LA Fitness that she has nearby. She has a membership for free. Now, AARP was in the news not that long ago for their United Health Plan, dropped their Silver Sneakers affiliation because they said only 7% of their population was using it. I was like, okay. The funny thing was United Healthcare is not the only game in town, man. There's like here at Blue Shield, they still have their Silver Sneakers program. So having access to the gym for free, in my opinion, makes sense because you're senior citizens. You want to stay in shape. You got to get the blood flowing. So I'm a fan of that. It's free. 24/7 nurse help. Hey, something. I woke up and my eye hurts. Call 24/7 home. Nurse, telephone, online support. Here's a big one from my aunt. The personal emergency response system, the 24/7 medical alert, free. This is kind of the bells and whistles that Jay was talking about. No cost to you whatsoever. It's like that John, I forgot his name, John from that show, America's Most Wanted. I forgot that dude's name. But anyway, he talks about the life alert or help I can't get up. That's what that is. A personal emergency response system. It's free, man, for their Medicare Advantage plan. I mean, that's a smoking deal if you ask me. So I'm a big fan. They talk about annual prescription deductible, zero. I mean, just you can read all this. I think it's fantastic. So anyway, so I default, like I said, is there anything else I want to see in here? We talk about prescriptions. Oh, so you can have more if you want the optional supplemental dental and PPO plans. You could between $12.40 for a participating dentist or $35 for a PPO. Or they have a non premium, but the non premium you pay more of a copay. I think is what it was. Yeah, you pay not copay, but for a crown. Yeah, that's what it is. So if you were to get a crown and you had the one with no deductible and no copay, you pay $430 copay for a crown, and the other ones are cheaper. So you can have some more on here. I would actually probably do it. I don't know. I mean, that's up to her. She can do whatever she wants, but I'm not sure why you wouldn't at least do this one right here. This Los Angeles County or Orange County, I presume. No monthly optional plan premium. So I'm not sure why you wouldn't sign up for it anyway. But she said she didn't. Look, she researched. I didn't. Optional supplemental plan for another $12.50, $12.40 a month, and then if you want the PPO. So I like that. I think one of the things that some folks post on their YouTube channel, as you get older, the teeth become more and more an issue. And I think they got vision services in here as well. So that's a rundown of some of the benefits you get in California for Medicare Advantage, but also some of the stuff you need to be looking at for as well. See what bells and whistles are. See if there's a prescription drug plan. Just look into it. Make sure if you do Medicare Advantage, you find out who's in network. Is your doc in network or not? My aunt was telling me that her insurance dropped her used PCP, primary care physician. When her insurance changed a few years back through work, they dropped who she was using before, and she had to go to a new person. And now the old person, who she liked much better, is on this as through the HMO, through the Medicare Advantage. So she's stoked. She's like, man, I got my old doctor back, and I only pay $145 a month. Not a bad place to be. All right. I'd love to hear your comments. If you have an experience with Medicare Advantage, Medigap, share them with people, man, because in the comments here, because I'm telling you, I'm just learning from asking people who are in it. So you might have more experience than me or some other guy who's looking at it. If so, help us out. Figure this stuff out. All right, we'll see you next time.